Hello, my name is KARLENY MASCORRO. I am a SLP graduate student at UT Health San Antonio, and I will be presenting on primary progressive aphasia, a case study examining the impact of an intensive therapy program on quality of life. Primary progressive aphasia is a neurodegenerative disease characterized by gradual deterioration of the brain regions responsible for the production and comprehension of speech and language. This rare disease is often described as a language-led dementia, which results in memory, attention, and behavioral changes. There are three main variants, including non-fluent, semantic, and logopenic, which are classified by the neuropathology and impairments or strengths in speech and language. Individuals with PPA and their caregivers are at an increased risk for reduced quality of life secondary to a decrease in communicative participation in activities of daily living. While numerous studies have previously focused on the impact of intensive therapy programs for individuals with post-stroke aphasia, few have evaluated the impact of a PPA-focused intensive therapy program on quality of life for individuals and their caregivers. The aim of this study was to determine whether there is an increase in patient and caregiver reported quality of life survey scores after participation in a 2-week, person-centered intensive therapy program for individuals with PPA. I hypothesized that patient and caregiver quality of life is expected to improve following implementation of a person-centered treatment program tailored towards increasing the patient's participation in desired activities of daily living. This case study took place at UT Health San Antonio's Aphasia Summer Program and focused on EN, a 74-year-old Latin male with a medical history significant for semantic variant primary progressive aphasia. The patient participated in 8 4-hour sessions with graduate student clinicians over the course of 2 weeks. Treatment sessions emphasized personally relevant goals utilizing direct and indirect treatment approaches. Scores for the Communication Competence Rating Scale for Aphasia, CCRSA, and the Communication Effectiveness Index, SETI, were obtained pre- and post-treatment and administered to the patient and the same caregiver who completed the survey initially. Comparison of scores pre- and post-intensive therapy program was used to analyze the data. Results of the study include the following. The patient's total pre-treatment TCRSA score was 550 out of 1,000, and the total post-treatment was 584 out of 1,000, demonstrating an increase in their confidence communicating. An increase in perceived communication effectiveness on behalf of the caregiver was demonstrated using the SETI, revealing a score of 58 out of 105 pre-treatment and a 68 out of 98 post-treatment. The total SETI scores were adjusted accordingly from 112 due to non-observed responses provided by his caregiver. Throughout the 2 weeks, the patient targeted the use of semantic features in semi-structured conversations utilizing the semantic feature analysis (SFA) treatment approach and demonstrated an increased usage from 46% to 56%. Additionally, he worked on incorporating the use of environmental support strategies to promote communicative participation, and he demonstrated an increase from 33% to 100% in a semi-structured environment. Measurable improvements were also observed in his initiation of conversations from 0% to 100% by the end of the program. The overall findings of this study suggest participation in a 2-week intensive therapy program may be effective for patients with primary progressive aphasia. Targeting the use of semantic features for personally relevant words is suspected to contribute to the patient's improved communication confidence due to increased support during word retrieval difficulties. In addition, the caregiver's perception of the patient's communication effectiveness is suspected to have increased due to the implementation of environmental support strategies in the home environment to aid in his communicative participation. One limitation of this study includes the small sample size, as it only represents one individual with semantic variant primary progressive aphasia. Further studies should examine the impact of participation in an intensive therapy program for individuals with primary progressive aphasia on their quality of life with a larger sample of patients. The author wishes to thank E.N. and his family for their time and effort during their involvement in the treatment program.